So now that everyone's awake, I'd like to introduce Emeritus Professor Jacquie Rand. She graduated with a Bachelor of Veterinary Science from Melbourne University in 1975 and worked in veterinary practice for 8 years before doing a residency and a doctorate at the Ontario Veterinary College, Canada, followed by 3 years as a senior registrar at the University of Zurich in Switzerland. She's a registered specialist in small animal medicine and a diplomat of the American College of Veterinary Medicine. She's very passionate about cats, and she's going to be talking about the Community Cat Program project in Australia. Thank you, Jacquie.
Thank you. Fantastic. Can you hear me all? Yes. Well, this is something I'm passionate about, and if anyone knows me, they'll know that. So, how many people here have been in the situation where they've had to euthanize a kitten like this? And you'll know that they don't just lie quietly, they squirm and they cry. How many people here have been in that position? Okay. If we implement this, we don't need to do this any longer. So on our best estimates of research that I've done, between 80,000 and 115,000 healthy and treatable cats and kittens are killed every year in Australian shelters and pounds. Half are kittens. And in fact, most are urban strays and they're semi-owned. And again, on our best estimates of what's happening across Australian shelters and pounds, the average euthanasia rate for dogs is 12%, the average euthanasia rate for cats is about 52%. And of course, we know it's not just the animals. And this was a quote from an RSPCA employee. The effect on mental health is a very real problem, and veterinarians were the most affected. It was terrible to see the impact on them. And another RSPCA vet in another state, I've seen so many people's lives damaged by having to kill a never-ending stream of cats and kittens. And it's been well documented that workers directly involved with killing animals develop post-traumatic stress, leads to depression, substance abuse, high blood pressure, sleeplessness, and increases the risk of suicide. And the staff turnover rate in shelters is proportional to the euthanasia rate. And I think we would all agree that we would be better off with fewer stray cats in our cities and towns. And I'd just like to clarify the definition that I'm using about stray cats and feral cats, and that's based on the 2018 report from the RSPCA on best management of domestic cats, that in fact how come this is not advancing? A feral cat is one that gets no food or support from humans, and based on the South Australian cat tracking data, the probability that it's feral is going to increase the further from human habitation, so about 2 to 3 kilometres at least. Whereas domestic cats, which include owned, semi-owned and unowned cats, get food either intentionally or unintentionally from humans. And they're found in urban and peri-urban areas, and that's what's largely coming into shelters, not feral cats. How does this change? Where do I have to point it to change it? Over to you? Okay. So, these urban stray cats, some of them are genuinely wandering owned cats. This is still not advancing very well. Okay. Some of them are lost owned cats. Some of them are abandoned cats. The people move house and they stay with the house. Now it's gone all funny. Yeah, what's happening here? But in fact, the biggest group are these semi-owned cats. And research that I've done shows that 3 to 9% of adults in Australia feed daily one or more cats they don't perceive they own. And so calculating this for Sydney and Melbourne, we estimate in the greater area of Melbourne or Sydney that represents about 250 to 300,000 urban stray cats. Can we get, there's no way this will advance quicker. Most are socialised to people. And if you give them 3 days to assess their behaviour, then most of those cats are not feral-based if you're using a behaviour-based test. But if you assess them in the trap cage, then about 90% you would assess as being feral. So what are our options for managing stray cats? We can continue doing what we're doing, which is largely accepting stray cats from the public and also providing traps to complainants or delivering the traps to complainants where they've got an issue with stray cats. And we're killing about 2 to 5% of that urban stray cat population every year in our shelters and pounds. And that really just creates a vacuum effect where cats in surrounding areas rapidly come in, and it's been shown to increase the survival of juveniles. And in fact, a very nice paper from Tasmania where they went out and tried to mimic what rangers would do over a year, and they had 2 control areas, 2 treatment areas. One of the treatment areas was a tip, and they went out and removed 30% of the cats over the year, and it rapidly increased cat numbers by 2 to 3 times, and when they stopped trapping and killing, the cat numbers subsided to what they were before they started trapping and killing. And so effectively, we are farming cats. In fact, what a farmer would do, we are sustainably farming them. We're keeping our breeding stock and harvesting our juveniles. And everyone's seen this quote. Doing the same thing over and over again and expecting a different result is insanity. So if we look at the data this is combined data from Lost Dogs Home and RSPCA in Victoria over a 6-year period, and during that time 134,000 cats were impounded, and of those 60,000 were euthanased. And did that make any difference significantly to intake? And this is not a significant change over those 6 years, despite killing 60,000 cats. We can kill them, and that's quite effective. The modelling shows that we have to kill 30 to 50% every 6 months, sustainably for over 10 years. And in fact, we would have to kill 15 to 20 times more of the stray cat population. Do you think the community is going to support that? And who's going to pay for it? And in fact, the council's going to need to do most of the trapping. And it's been reported that it takes 4 to 6 nights per cat to get a whole colony. And clearly that's associated with a lot of cost. Do you have a better advancer? Seems to be very slow. So in a city of 5 million, in the first year alone, killing 60% every 40% every 6 months, we'd have to kill about 200,000 cats. And at $500 a cat, that would cost about $100 million. So that's the trapping and the euthanasia rates and the body disposal costs. And also, we would need to build facilities to hold them so we can assess them over the minimum holding period before they're killed. And that will result in a whole pile of dead cats and cost a whole lot of money. can try feeding bans, and the Brisbane City Council are implementing this as a strategy. The question is, who's going to feed it? There's no city where a feeding ban has been reported to be effective in eliminating cats. That's because you simply cannot ban compassion. And those people have been prosecuted, taken to court and fined. They're doing it again and getting prosecuted, taken to court and fined again. I've just heard about one person who's on New Start, and the second fine is $6,000. And another person has spent all her superannuation on this. So you simply cannot ban compassion. There's not enough officers around, and in fact, cats will find food. And you've got to have CCTV cameras out there, you've got to go down and look at the footage, you've got to go down and serve a summons on them. It's a very expensive exercise. Or we can implement community cat programs where stray cats are caught and desexed, and then they're left where they're living if they're in a good condition, and ideally supported. Adoptable cats and kittens are adopted or rehomed, and in the best programs and the one that we're planning, they'll be vaccinated, wormed, and given flea control, and they will be microchipped and ear-tipped. And just to show you some data to show that it works, this is from Gainesville, Florida. This study's been published, and they took a postcode which was overrepresented by cats coming into the shelter, and they desexed just over 2,000 cats in the 2-year period, which was about 60 cats per 1,000 residents, and they estimated through a telephone survey that that represented about 54% of the unowned cat population. And there was low-level desexing going on for these unowned cats at about 8 cats per 1,000 residents. And if you look at the results here, the dotted line, and I don't think have I got a pointer here? Yes. So the dotted line you can see at the bottom, which quickly increases, that's the number of desexing. So you can see how the desexing's changed. And then the dark line at the top that drops very quickly is shelter intake of cats, and the other grey line is euthanasia. And you can see how quickly they drop off once this intensive desexing of stray cats is implemented. And this was the control area, and you can see that intake was 3.5 times higher in the control area that had this low level of sort of scattergun approach, and that euthanasia was in fact 17 times higher in the control area. And some other, now that in the last couple of years particularly, there's been a whole plethora of publications come out demonstrating it works. And the very first one that was really started 30 years ago, which was around a port area, they had 300 cats. Now it's estimated that it's actually cat-free, but they're monitoring it. Albuquerque implemented a community cat program, which was intensive desexing, and their shelter intake dropped by 39%, and their euthanasia rate dropped by 85%. And this is the most recent paper. It's just come out this year, where they reported 6 cities in America that ranged from just under 200,000 people to just under 2 million people. And they did intensive but very, very targeted desexing. And they desexed over those 6 cities 71,000 cats. 83% of them returned to where they were found, 15% were adopted. And intake after the 3 years was decreased by 32%, euthanasia was decreased by 83%, and half of that decrease occurred by the end of the first 12 months. So it's really quick if it's intensive. And this is, it's been published from the University of New South Wales, and they had a cat-related problem on the campus, and in fact, cat-related complaints were in the top 3 coming to the university properties and facilities, along with parking and garbage disposal. So then they called in a pest control company, and it's reputed that they spent about $40,000 in 4 months. They caught about 13 of the cats. They took them down to the local pound. Then staff were going down and claiming them back from the pound. And the complaints increased. So they could see this was a really good business model for the pest control company, and they'd be spending like $100,000 a year. And so at that point, the staff approached them and said, how about we implement a community cat program, or a trap, neuter and return program at that stage. The university actually paid for the desexing, but said then after that, we expect you to pay for the ongoing costs. And with that program now, there's about 12, I think, elderly cats. They're living into their mid to late teens. Some of them are being treated for hypothyroidism. They're being monitored with motion detection cameras to see whether they turn up or if a new immigrant cat turns up and that cat's being managed. So it's been very successful. No more complaints to the university. It's not costing the university anything. They're really, really happy with it. And we surveyed people in Australia that were doing trap, neuter and return illegally, and out of the 37 colonies that totaled a total of 515 cats, within 2 years that had reduced to 344. So about a 30% decrease, which is exactly the decrease that occurred at the University of New South Wales, 30% in 2 years, and they got 50% in 5 years. And people pay for it. You know, it's not costing governments anything. The people are feeding them at least once a day, if not twice a day. They're vaccinated, they were given health care, and even 44% of them microchip them and put their name on the care on the thing. But the key is that it's got to be targeted. If you just do a scattergun approach and offer vouchers or free desexing to anyone in the community, then you can see with this situation that in those colonies where some of the cats are not desexed, they can overcome the reproductive loss of those that are desexed. It has to be intensive. So you have to go in and do intensive desexing in the areas that are contributing most to your intake. And you still have to monitor them. And what's been shown is that it's good for dogs too. It decreases dog intake into the shelters, probably because a community liaison officer there is in the community telling people about it. And you get increased live release rate because there's a whole lot more resources for those dogs with behavioural health problems that need some help. But of course there's objections about their welfare. You know, neutering and return to site's been associated with an improvement in health and body condition, or at least no decrease. This was from the SPCA in Auckland, and they showed that the cats in the colonies, after desexing, their health and welfare was not different from pet cats with outdoor access. And the paper we published from the University of New South Wales, where the death rate was 8% per year, that's what's reported for pet cats. You know, if they live to an average age of 14, about 8% die every year. They're not immortal. And of course, this is the one we hear all the time, and the Animal Ethics Committee at the university was concerned about this. Well, you know, people don't want predation of wildlife, and we have to decrease the number of urban stray cats to do that. And we can either spend, in a city of 5 million, $100 million in the first year, or we can desex them and leave them where they are. And yes, that cat that we put back, it might kill a bird. But if you've got 100 cats now that are entire, what's going to kill more birds in 2 years' time? 100 entire cats or 66 desexed cats? You can't have no cats. It's just not possible. So that's the question. You know, what do you want? And in fact, this is a statement from Wires, who are supporting the project, that they are keenly following it and hope that this approach will lead to long-term benefits to wildlife in cities and towns throughout Australia, by reducing the impact on native animals. And we hear this, spread of disease to humans. But in fact, that most people are concerned at toxoplasmosis, and if you understand toxoplasmosis, cats get infected by it, they shed for 2 to 3 weeks, and then they become immune. And if they remain in good health, they largely, most often do not shed again. And most new infections and shedding occur in cats less than 1 year of age. So if you go and do a trap and kill program, you've always got kittens being born, and that those kittens will get infected and shed toxoplasmosis oocysts. But if you actually desex them, then you're going to reduce that environmental contamination. And of course, also the risk of disease to pet cats, which will be decreased by fighting the cat bite abscesses and spread of FIV. And in fact, FIV frequency has been shown to decrease in colonies managed by desexing. Will the community support it? We did a survey of 1,200 people, and 70% said yes, they believed that cats had a negative effect on wildlife in their area. 24% said for dogs. And then we said overseas programs exist where stray suburban cats are captured, desexed, and then returned to where they're captured. And these programs have been shown to reduce the number of complaints about these cats and to reduce stray cat numbers put to sleep. Would you support a trial like this in your area? And 82% said yes. So, you know, what have we got for alternatives for managing cats that are coming into our shelters and pounds? We can keep doing what we're doing, essentially farming them. We can kill a whole lot more. We can ban feeding, but it doesn't work. Costs us a lot of money. No one's got a magic wand yet. Or we can adopt or desex, adopt, or leave them at their home location, which will decrease the population of stray cats. It'll decrease intake of cats into shelters and pounds. It'll decrease killing in shelters and pounds, decrease cat-related complaints, and it will decrease impact of killing on staff and decrease costs to the community. And without community cat programs, someone has to kill the cats and kittens. And some of those people are sitting here. And killing healthy animals damages people's lives, and in some cases, killing animals kills people too. And the workplace suicide rate now in North America for this sector has been reported to reach #1 spot with police and firemen. And in Australia, police and firemen are limited to the number of traumatising accidents they can go to. But we don't limit the exposure of our staff to these traumatising effects of killing animals. So the aim of this community cat program is to investigate the effects of desexing. And it's for semi-owned, unowned, and in the target areas owned cats. And our outcome measures, we're looking at a decreasing intake and euthanasia of cats and kittens into shelters, community attitudes and cat-related complaints. We're looking at mental health effect and job satisfaction on shelter and pound staff and cat carers. We're looking at cost benefit for both shelters and councils of doing this compared to business as usual. And we're looking at the relative risks of disease spread to pet cats, humans and wildlife. We're looking at the numbers of free roaming cats and also wildlife predation and cat roaming. And so we're going to desex cats in the target area. We're going to give them healthcare. They're going to be microchipped. Those that are readily adoptable will be adopted, but the other healthy cats will remain in their home location and, if possible, with an identified carer to support them. Where consent is given, semi-owners will be converted to owners and they will be registered on the microchip database. And we will be offering free desexing to own pet cats in those target areas as well. And also, in part of this trial, is that unowned cats that are unclaimed at the shelter will be brought in, or that are brought in by members of the public or the council, will be desexed and returned home if they are not microchipped or reclaimed. It'll be combined with a community education program about the importance of desexing, about the importance of confinement and helping people with that confinement, the importance of having a collar with an ID tag so neighbours can get a cat back to them. We'll be implementing best practice in resolving community disputes, and you heard about those cat repellents. We'll be providing those free, and also combined with a lot of community education about community cat watching. Like those ear-tipped cats out there, if they're healthy, they're not lost. Leave them. But if it's injured or if it's sick, let us know, because that cat's got a microchip and that cat has got some organisation which will care for it and take responsibility for it. So we're going to be doing it in Victoria, in Banyule, and if you know that, in Heidelberg West and Belfield. We're all greater city of Shepparton, the city of Melbourne, with the desexing being done by the Lost Dogs Home. South Australia will be Port Lincoln, either Port Lincoln or Whyalla. New South Wales, the Sydney Dog and Cats Home, and in Queensland, it will be Ipswich. And in Queensland, Green Cross is going to provide $500,000 of desexing for us free. MSD, Animal Health, is going to be providing all the vaccinations and the ectoparasite control. And I'd just like to give you an example of this benefit just as I wrap up. So the Lost Dogs Home in Melbourne is one of the largest shelters in Australia. They received, I think in the last 12 months, just under 10,000 cats, euthanased just under 5,000. But based on the papers that have come out, in fact, if they desex 6,500 cats a year for 3 years, target to the areas that they're coming in from, in just 3 years, they could go from killing 5,000 cats to under 500. And they would reduce costs because because shelter intake's reduced. So people in this room, if you don't want to keep killing cats and kittens, we've got to stand up and advocate for this. It's illegal across Australia, but we're getting the permits to allow us to implement it. We've got a couple of slots for shelters that might be interested in joining it, but after that it will close. We've already got animal ethics approval to start it, but we're just waiting for state government approvals. So if you're interested, come and talk to me, but this is the way of the future. We can't keep killing cats.